I'm Sebastian Szmid. I'm from Warsaw, Poland. I work in the Institute of Hematology as the teacher of Center of Postgraduate Medical Education, and I am consultant at the Institute of Oncology in Warsaw also. My topic was dedicated to thromboembolism. I'm just after my session with excellent discussion, and I had the opportunity to discuss the problem of thromboembolism related to different cancer diseases. At the beginning, I presented the data about the premature mortality related to venous thromboembolism in cancer patients, and I explained the value of anticoagulation. And of course, I started the discussion with guidelines, CSC guidelines, because European Society of Cardiology proposed two options for anticoagulations in patients with cancer and VTE. First option is to use new oral drugs, DOACs, for example, apixaban, edoxaban, or rivaroxaban. The second option is to use low molecular weight heparin. And I explain very clearly, I try to do it, why we should use sometimes DOACs, but there are some patients who should be treated with low molecular weight heparin. The problem is associated with the risk of bleeding. Some patients with the special localization of the cancer disease, especially patients with GI cancers, should be treated with low molecular weight heparin because the risk of bleeding is higher when we use rivaroxaban especially and edoxaban. The problem of apixaban is more difficult because we remember the study Caravaggio. This study confirmed that the efficacy and safety of apixaban may be the same like in low molecular weight heparin in patients with GI cancer also. The second problem was the drug-drugs interaction. I presented some data about that, how to avoid to use DOACs. We should prefer low molecular weight heparin. And the next problem was associated with thrombocytopenia. I showed my study, my paper, when we should prefer low molecular weight heparin in reduced dose, but sometimes very promising is to stop anticoagulation and wait to normalization of the platelet level. The next part of my lecture was dedicated to extended anticoagulation. In my opinion, that was the most important part of my lecture because this year my research group presented the new data from APICAT study, and we confirmed that the reduced dose of apixaban should be understood as the such efficacy options like the full dose of apixaban. And most important is that APICAT study confirmed that the risk of bleeding is significantly, the frequency of bleeding was significantly lower when we use reduced dose of apixaban in comparison to full dose. So the conclusion for this part of my lecture is when we extend anticoagulation behind 6 months, we should rather reduce the dose, especially of apixaban, because we have the data from APICAT study. And the last part of my lecture was about primary preventions, very problematic topic. I presented some guidelines, for example, ESMO guidelines, which recommend to use primary prophylaxis in selected patients, and when we define such patients using coronary score. But in my daily practice, based on my daily practice, I can confirm that this score is not so effective because this score does not include the data about cancer therapy. I prefer, based on my daily practice, in some very easy example, when we have the patients treated with immune checkpoint inhibitors, we should at least consider primary prophylaxis. And then last point was dedicated for myeloma patients. We have new document published by our European hematologists, and the first time European hematologists listed as some options of anticoagulation together low molecular weight heparin with rivaroxaban and apixaban. This is very important, but next time we should remember about the risk of bleeding, about the renal function, because DOACs, the efficacy of DOACs and safety is associated with the renal function. So that is very short summary of my lecture. Thank you for the organizers of GCOS in South Africa, in Cape Town, for inviting me. That was the great pleasure to present my data and my own experience. Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.